Hi guys, it's Monica. Listen, this is a special edition moment for MoTalk. The Mo moments are important to me because we touch on issues that are plaguing our communities, our lives, our families, and our health. In 2021, my health and the awareness for it is really important to me, so I'm talking to Dr. Anthony Fauci about the COVID-19 vaccination and how we can better prepare ourselves for either taking it, not taking it, and protecting our families overall. I'm glad you guys are joining me. Stay right there.
Hi, how are you? Nice to see you.
Nice to see you as well. I'm so excited to talk to you. Thank you for taking time to do this.
My pleasure. Good to be with you.
Yeah, we have had quite a tumultuous about 14, 15 months here, and it has been difficult. I'll jump right in by saying, as a mom, there are a lot of different fears that I have, and I wanted to ask you for your not only direction, but advice and all of the things that you found to help assist people like myself. I have 3 children, ages 7, 12, and 15. Every day they get up and they go to school. The school has definitely done what they could. Plexi around desk, masks are mandatory, things of that nature. But what is it that we can do to ensure that our kids are safe as possible in these particular times? For instance, do we not send them to school? Is it safer for them not to be in that environment, regardless to the fact that they have taken some precautions? Is it better for them to be homeschooled? Do they mask? Are there certain things they should eat? What are your findings when it comes to kids?
Well, first of all, it's very important that we, as a default position, try to keep the children in school, minding that it's important to make sure you pay attention to doing whatever you can to ensure their safety and their health. The studies have shown that when there's a lot of COVID-19 in the environment, outside in the community, children in school, if they do the proper types of things, namely wear a mask, do the kind of physical separation to the extent you can if you have space in school, that we should try to keep the children in school, because the deleterious effects of children, keeping them out of school for a prolonged period of time, has negative effects not only on the children, but in general on parents who might have to essentially not go to work to take care of their children. So it really disrupts society. What we hope is going to happen, and happen reasonably soon when you talk about things, is that as we get vaccine rolled out, and we get a substantial proportion of the population vaccinated, that the level of infection in the community will get so low that it ultimately will make it better for the children, because their risk will be much, much lower.
And the vaccination, it's not been made totally available to the public, but as it is, I realized in all fairness that there are some fears there. And people have seen many things. A lot of us are, of course, on social media, and we've seen things where people have had adverse effects to being vaccinated, or that is what they feel has caused things like Bell palsy. And have you had any experience with that?
You know, if you look at the risk benefit of vaccines in general to the health of the nation and the world, overwhelmingly, the benefit outweighs the risks. Whenever you give any intervention of any type, there is always a very, very small fraction of people with vaccines who will get an adverse event. Almost all of them are able to be handled. You are correct that with the vaccines that have been used now, there have been some reports of people who've had allergic reactions. Almost all of them were people who have a history of severe allergic reactions. So the recommendation now is that if you have a history of allergic reaction, you get your vaccine in a facility that has the capability of treating or responding in a positive way to treat your allergic reaction. So just because people have allergies doesn't mean they should not get vaccinated. Apart from allergies, there has been virtually no significant adverse events that have been reportable and directly caused by the vaccine. So in general, when you talk about interventions that people take, vaccines on the scale of safety are very, very high up there in safety.
For those that have been pretty much afraid of what they've seen, your suggestion to them is still to be vaccinated with the understanding that you can have an adverse effect from any vaccination, not just the one for COVID-19. Is that what you're saying?
Absolutely. And thus far, the vaccine for COVID-19, relatively speaking, has been really quite safe. There have been now about 4 million of the vaccines given out. We hope that we'll get up to 280 million. But right now, of the 4 million, there has not been anything that is troublesome with regard to adverse events, except those allergic reactions, which were treated appropriately, and there was no deleterious consequences after that.
And you yourself were vaccinated, correct?
I was, and I'm going to get
What was that experience like?
It was quite benign. I got vaccinated. I got about maybe 10 hours after a little bit of an ache in the arm that when I pressed on it, I felt it. When I didn't press on it, I didn't feel it. I was expecting that I might get some muscle aches and a little headache. It never happened. I'm going to get a booster shot in January 19th. I'm going to get my booster. And I may get some aches and pains for 24 hours after that, which is something you get with many vaccines that, within a 24-hour period, you don't feel 100%, but virtually everybody bounces right back and gets back to normal very quickly.
When I speak of the fears, and I say people are afraid, people is me. I am definitely, I'm unafraid to say that I'm afraid of it, but I do want to make sure I'm taking the necessary precautions. Every day when we work and we film, and it is the way that I feed my family. So like many, we are trying to figure out the safest ways to work. What is a good schedule for the way that we test? We test every other day. Is that sufficient enough, or is the proper space still very important, as well as masking? And we mask and wear shields for staff, but for myself as talent, I typically don't have anything on. Everyone around me does. What do you think would be the safest ways for all of us to work? Because even people in office spaces, cubicles that have started to separate, they still want to know exactly what to do in those spaces.
Yeah, what I just heard from you, Monica, it seems like you all are doing a pretty good job. Testing every other day is about what I would have recommended. And for people, obviously when you're performing, you can't have a mask on, so you have to perform without a mask. But if you have people who are staff and they don't need to be performing, to have them wear a mask, and that makes sure that they don't congregate in closed spaces together, and they try to maintain a physical distance. Sometimes you can't do that. When you're performing, you're close to somebody. But as you say, that's the nature of your profession. And when you get tested every other day, you can get a pretty good feel for whether or not you're safe. But for those around you, I think it's very important to wear masks. The other thing that you should do is that when you're not performing, you should be wearing a mask.
Yes. Okay. And testing with children, it's something else that comes to mind very strongly for me. My 7-year-old, I allow her to be tested through saliva. Of course, I don't allow them to go into her nasal passage like they do myself. Is it important for kids? I've heard a lot of talk about under 12, they don't test as much. Is it very important for us to maintain the safety of our children by testing them as well? Or are you finding that they aren't carriers as much as some would think?
Well, no, children can carry it. The children from like 10 to 19 can transmit to adults as well as adults transmit to adults. Younger children, not necessarily as much. But still, in school, what we're trying to do is to see if we can get the teachers tested, just like you in your profession, at least twice a week, and test the children anywhere from 1 to twice a week. And when a child gets infected, children tend to do much better. Although there are exceptions and children can get seriously ill, they tend to do much better than adults. So if you get a child that's infected and doesn't know it, and you don't test, that child can bring the infection home and infect someone who is vulnerable and could get serious disease. So that's the reason why the idea of testing children is a good idea.
Okay. I wanted to ask you about the PCR versus rapid test accuracy. Comes up quite often, and people, of course, want to take the fastest route in finding out. What has been your findings with the accuracy?
Okay, so when you have a test for COVID-19, for SARS-CoV-2, there's a thing called sensitivity and there's a thing called specificity. Sensitivity means, does it pick up all of the cases that are positive? Specificity means, do you really get the right answer, or could you get a false positive? It's like you think you have it, but you don't. So what you need to be concerned about when you're talking about the difference between the PCR and the antigen test is you want to see how sensitive it is. PCR is the most sensitive. It's like 99% sensitive. The antigen test, depending upon which one you use, is, some of them are 85% sensitive. Some of them are 92, 93% sensitive. They're getting better and better. So if you do an antigen test frequently as a screener, then you make up for the lack of sensitivity. But if you absolutely want to know if you are infected because you've been exposed and you have reason to think you might be infected, then you want to do a PCR. But if you want to screen the cast, you don't need to do a PCR. You could do an antigen test if you do it frequently enough, because the frequency of testing makes up for the relative lack of sensitivity.
So it's not a good idea if, let's say, you're having a small gathering and you decide rapid testing is what each person would do before they enter. That's not the way that should be done. It should be done pretty consistency. The consistency will allow you to know.
Yeah. In other words, if you were, let's say you're having a dinner party.
Okay.
And you want to invite 15 people. If you have them all do an antigen test and they're all negative, the chances of there being a positive person there is really very, very low. So I wouldn't say that's not a good thing. But if you really wanted to be absolutely sure, you'd say, okay, what I'm going to do is I'm going to give you 3 antigen tests. Take one Monday, Wednesday, Friday. I'll see you on Saturday for a drink. That kind of thing. But I don't think, Monica, you need to do that. I think if you want to do the kind of screening that would not give you 100% accuracy, but will give you enough to feel comfortable, I think you just could do that once.
Okay, understood. I didn't tell people that I was talking to you, but I decided last night to just kind of seek out and see if there were some questions that people had that they wanted to ask, that maybe they wouldn't have access to ask someone with your type of experience. Would it be okay if I asked you a couple of the questions that were asked of me?
Of course.
Okay. One of which, I do a lot of work with prison reform, and an inmate that I am very close to wanted to know, when do you think the vaccines would be made available to those that are incarcerated? They had a rapid rate of people being infected and actually had many to die on a tier that he actually is an inmate on. And the concerns for the elderly, a lot of people don't think about the ideas of, when people are incarcerated, we think about the young and we think about the things that we see on the news that are happening very currently, but there are people who have been incarcerated 30, 40, 50, 60 years. So they're elderly, they're already very sickly and are pretty much battling other things, cancer, different things. And those are the ones that are terrified of COVID-19. And that was one of their biggest questions. When do you think that this vaccination would be made available to inmates?
Well, inmates are in confined quarters by nature of incarceration. And we would hope that by the time we get to April, that we will have vaccinated all of the people in the higher priority groups. And people in enclosed places like nursing homes and prisons are in that group. So I would imagine by the time we get to April that we hopefully will have gotten the prisoners vaccinated. Then we could get open season that anybody who's anybody can wind up getting vaccinated.
Okay. Another was from Truly Sincere. Is it safe for everyone, including HIV patients, to be vaccinated?
Yes. There's no reason for a person not to get vaccinated if the vaccine has been approved for your particular status. Like right now, it hasn't been approved yet for children, and pregnant women, but we're going to get to that because we're going to test them. But an HIV-infected person should get vaccinated. An immunosuppressed person should get vaccinated. There is a misperception, Monica, that if you are immune suppressed, that you shouldn't get vaccinated. The fact that you are immune suppressed means you may not get as robust a response to the vaccine, but it would not be unsafe. And I say, even if you don't get an optimal response to the vaccine, a less than optimal response is better than no response.
I see. Okay. Me_forever asked, is it true that the vaccine will alter a person's DNA?
It is absolutely untrue.
Okay, I figured that. I have another one. What are the best things to boost our immune system?
You know, a lot of people take things that they buy in stores. None of them really boost your immune system. The best way to boost your immune system, get plenty of rest, get exercise, have a good diet, and that is the best booster of all. Make sure you're not deficient in vitamins. If you have good levels, you don't need to take extra. One of the big deficiencies that some people have, more among African Americans than Caucasians, is vitamin D deficiency. So if your vitamin D level is normal, don't worry about it. If it's low, you should get vitamin D supplements. But a lot of those herbs that say they boost your immunity, that's more a placebo effect than anything else.
Got you. You know, for people like myself, both my mother and I are hypertension sufferers. And being on other medications, do any of those alter what happens if you're vaccinated? Being that we take a daily dose, that's something that I've worked really hard to get myself off of properly, of course, with doctor's care. But for the people that are diabetic, they have high blood pressure, already maybe being treated with chemotherapy, do you still suggest that they be vaccinated the same?
Absolutely. Absolutely. In fact, they, more than anyone, should not avoid vaccine. Because if you have those underlying conditions, Monica, then you have a greater chance of getting a severe COVID disease. The severity of disease is increased if you have diabetes, hypertension, obesity, heart disease, lung disease, kidney disease. So some people might feel, well, I'm sorry, but I have this underlying disease. I should not get vaccinated. No, that's all the more reason why you should get vaccinated.
Okay, that's definitely something I wanted to share. A lot of times the lack of information is it's the thing that kills us most, because when you don't know, you do better when you know better. And a lot of our people need to be informed in every different facet if possible. My very last question to you is, as we start finding that the vaccination is more readily available, what are the best ways for people to get out and be vaccinated? Where should they go? Are there places where they can source out information for where they live? Most of us have no idea what to do. This is the first for all of us. What is a great place for them to find information and locations?
CVS or Walgreens are going to be the major places where it's distributed, as well as they will likely be the opening of community vaccine centers. But in the regular place where one lives, it should be the pharmacy, CVS and Walgreens.
Okay, thank you so much, Dr. Fauci. We appreciate you from the bottom of our hearts, and let me know how you're feeling as time goes on.
All right, I will. Thanks a lot, Monica.
All right, thank you so much.
Good to be with you.
Good to have you. Thank you, Dr. Fauci. That was so much pertinent information that we all need and can use, especially in our families as we navigate our lives through COVID-19 and in making our decisions to vaccinate or not. Y'all tune in next time, because you already know, ain't no talk like MoTalk.